Hi, everybody. Dr. John here with LifeSpa Ayurveda. Today, I want to continue our discussion about breathing, particularly the difference between vertical breathing and lateral or horizontal breathing. Most of us breathe in a vertical way. We breathe with our belly, then our chest, then our upper chest. And there's nothing wrong with that as long as you're also breathing laterally or horizontally, where the rib cage knows how to expand laterally. Sadly, because the rib cage has a thing called elastic recoil, and we get stressed out and breathe more shallow, the rib cage, like a balloon, is going to always want to squeeze the air out. And over years and years and years, the rib cage becomes tighter and tighter, sort of like a cage, squeezing on your heart and your lungs 26,000 times per day. So we have to learn how to get that rib cage to be more and more elastic over time. So one of the ways we do that, and I wrote an article called The Best Diaphragmatic Breathing Exercises, to actually use techniques to sort of, in a calisthenic type of way, break up the scar tissue between your rib cage and your diaphragm. And there's a technique in Ayurveda called Durga Pranayama, where you breathe belly, chest, upper chest, and you learn how to feel the distinct layers of breathing. Your belly is one area, your chest another, your upper chest another. We talked about taking your arms up and breathing in as much as you can as you breathe, as your arms go up as high as they can, to sort of floss the diaphragm. And I love this technique because we have to kind of break up the scar tissue between the diaphragm and the rib cage first and foremost. So I always invite my patients to watch the best diaphragmatic breathing exercises. There's 3 videos. You watch that first, and you do that for a couple of weeks to kind of really get that rib cage elasticity back. And that's learning belly, chest, upper chest breathing. That's taking your arms up, reaching for the sky as you breathe in through your nose, and then come back down with each breath, going to the side, breathing in, and then out as you breathe out, and then doing some simple yoga postures as you do belly, chest, upper chest breathing. And that's really more simply designed to get the rib cage to go up, the diaphragm to go down, and force the rib cage to become elastic. Putting yourself into a yoga-like posture, right? Where you're breathing into that rib cage, belly, chest, upper chest, to force the rib cage in different vectors to create more elasticity and less restriction of the rib cage because of a super tight rib cage and a diaphragm that's simply not functional for you. Then once you have some elasticity back in your rib cage, then you can begin to use what I call lateral breathing. And that's what I want to talk about today. If you watch a baby breathe, their belly goes out, but their rib cage goes out side to side as well. If you watch a dog or a cat breathe, their rib cage goes out to the side. They don't breathe belly, chest, upper chest. If you watch a horse breathe, their rib cage goes out really wide like that. They're breathing laterally or horizontally. And that's what we have to learn how to do. And the reason for that is because, first, the majority of the alveoli for exchanging oxygen in and waste out, or CO2 out, is in the lower lobes of your lungs. It's a gravity-fed system. So all the blood sort of gravity sinks to the bottom. So if you're not breathing down there, we can create real problems. Also, the rib cage over time has become sort of very, very rigid. You know, this happened to us when we were little kids. We have 6 kids, and we would watch the little kids with these big little bellies, and they go to, school and kindergarten, first grade, and all of a sudden they lost that kind of nice little belly, and we start sucking it up and breathing shallow. Every stress that you've experienced in your life changed how you breathe. And the interesting thing is that changed breathing pattern very quickly becomes normal for you. Another stress comes along, you change your breathing pattern, and that becomes normal. 20, 30, 40, 50, 70, 80 years of that, you're breathing completely different than you did when you were a young child, fully expanding the rib cage both vertically as well as laterally. We've lost a lot of our rib cage elasticity. And I've written so many articles about the diaphragm and the research on strengthening your diaphragm, from 10, 15 studies on heartburn, GERD, reflux, indigestion, lower blood pressure, approved for COVID before, during, and after. The number one pump of your entire lymphatic system is your diaphragm. The number one pump of the whole brain lymphatic system, which I've talked about so many times, about how the brain dumps 3 pounds of trash out of your head every year while you sleep. And Ayurveda understood this thousands of years ago and developed breathing techniques and nausea techniques to clean out that brain lymphatic system. Tons of research for you to go to my website, lifespa.com, learn more about that and understand the whole idea of how all of this connects. From your diaphragm to your digestion, from your diaphragm to your lymphatic system, to your diaphragm to your low back, from your diaphragm to your brain respiration and detoxification, and to your diaphragm to supporting your immune response, which is carried through your lymphatic system, which is pumped by your diaphragm. And in one very recent study, 91% of the athletes who were tested did not have a diaphragm relaxing and contracting fully, right? So none of us really do. So this is a really important understanding. So we have to practice lateral or vertical or lateral or horizontal breathing. I like doing this in bed, first thing in the morning, and right before I go to bed at night, lying in bed. You can do it sitting up, you can do it anywhere, definitely not in the jacuzzi or standing up, because you always want to make sure you don't get dizzy doing any of these breathing techniques. You never force, you never have to feel turn blue or overexert. Always go to your doctor, check, make sure it's okay for you to do breathing exercises before you start any breathing program. But here is how you do lateral breathing. I'm going to ask you to breathe through your nose. And there's an article about this step by step along with this video, so please know about that. When you breathe in through your nose, and all the breathing techniques I'm sharing with you are going to be nasal breathing techniques. My first book, Body, Mind, Sport, I did research, published studies in the International Journal of Neuroscience on the difference between nose breathing exercise and mouth breathing exercise. I've been teaching nose breathing exercise since 1987 when I came back from India in my Ayurvedic studies, and I learned about the difference between nose and mouth breathing. So we have really good science. You can go look about that. We have an article on how to get into the zone with nose breathing, and I give you a step-by-step workout there as well. All that, lifespa.com. So lateral breathing is when you actually are not going to move your chest, you're not going to move your shoulders, you're only going to move your abdomen a little bit, belly out, but then you're going to try to push the air out to the sides of your rib cage and even push into the back a little bit. So let's do this all together. Let's just breathe out gently through our nose, just a little bit out through our nose, and then breathe in through our nose and breathe the belly out a little bit, but then push those rib cage out to the side. Feel that pressure in the rib cage, out to the side, and then let the air come out. Again, feel the belly just a little bit as you inhale. Push that rib cage out to the side. Don't let your chest fill up. Don't let your upper chest fill up. And then breathe out as well. One more time, breathe in. Just push those rib cages out to the side. You can feel it's like pushing air into a balloon way down there. Keep pushing more air. And then let that air out. This time at the very top of that breath, as you get all the way in, you're feeling pressure as you're pushing out to your ribs to the side and even into the back. Take little sips of air to kind of pump the air into that balloon and create as much elasticity as we possibly can. So let's try that together. Let's breathe in, belly, and then rib cage out to the side, push it into the back, take as much air as you can, don't move your shoulders or chest, and then take little sips. And really feel the pressure of that balloon pushing that rib cage laterally, and then let the air come out. The reason why this is important to get lateral excursion of your rib cage is because when your diaphragm contracts, sucking air in, opening up your rib cage, when you actually exhale, the rib cage will naturally want to come together. But if it comes too tight and collapses too much, then what happens is there's no room for the diaphragm to relax and inflate like a parachute into the lower lobes of your lungs, pushing that air out in a more efficient and complete exhalation. There's something called dead airspace, which is the air that sort of never moves out of your lungs, and it's about 500 milliliters. But as you become a better exhaler because you have more lateral excursion, which means the rib cage goes out naturally wider, like a horse breathes out so far. And when the diaphragm relaxes, the diaphragm inflates up underneath that rib cage and pushes all that dead air space out, or a good chunk of it, which makes a huge difference in terms of how much more air you can naturally breathe in and exchange oxygen in and carbon dioxide out. So your efficiency and effortlessness and ease of breathing comes from elasticity. Thus, yoga has been a tool to create rib cage elasticity to support a healthier and more functional breathing practice. So the pranayama and the yoga and the meditation, they all go together, all sort of working the biochemistry and the biomechanics of breathing. Like I said, the impact of a functional diaphragm is, from your digestion to your blood pressure, to your lymphatic system, to your immune system, to your brain lymphatic system, to so many different things, your lower back even. So much to talk about here. Now, the other piece of this puzzle is your exhalation. As you breathe in through your nose and laterally excurge, you can actually take a tape measure and put it around your rib cage, and you can see how far out that rib cage expands and measure yourself over time. The rib cage, when you actually breathe out and you take a tape measure, like a cloth tape measure, and breathe out all the way, you can take a measurement. Then when you breathe laterally and push that rib cage out, you can actually measure the difference of your exhalation and your inhalation with lateral excursion, lateral or horizontal breathing. And you can measure that difference is going to get greater and greater over time as you become a better lateral breather. You can also just put your fingers right here and then breathe in laterally and watch your fingers move. And then they come back in when you're done. Now, the exhalation is the other half of this puzzle. We have something called the transverse abdominal muscles, and the other abdominal muscles are secondary muscles of breathing. And they're really involved in the exhalation. When you use an Ayurvedic technique called Ujjayi pranayama, where you constrict the back of your throat, kind of like if you're cleaning your glasses, you make that sound with your mouth closed. And if you breathe all the way out, slowly and kindly and gently, you'll see that your abdominal muscles will automatically engage. So what I want you to do when you exhale is I want you to feel the rib cage sort of narrowing, squeezing that transversus abdominal muscles, and then watch your Ujjayi pranayama force your abdominal muscles to contract. So when you breathe in, your belly goes out a little bit, rib cage goes wide. When you breathe out, rib cage goes narrow. Your Ujjayi pranayama squeezes those abdominal muscles, and you squeeze all that air out. The diaphragm relaxes, inflates into the lower lobes of your lungs. You push out that extra air, and the inhalation is a natural response to that full exhalation. So that's what I want to leave you with today, is that experience of a full exhalation that responds to a natural snapping reflex inhalation. So it looks something like this. Breathe in, lateral excursion, breathe out, rib cage goes narrow, squeeze the air out. Inhalation is automatic. Rib cage goes out. And then as we exhale, squeeze your rib cage together, kind of they become narrow. Abdominal muscles contract with Ujjayi. Squeeze the air out. Rib cage inhale is out. So that is how you breathe. Eventually, over time, you can tie that together with a full lateral inhalation with the rib cage expanding as well. You don't only have to breathe down here. We are designed to breathe in the upper chest. When that creates an activation of the fight or flight nervous system, which can stimulate you and give you access to get up or get away from a bear if a bear is chasing you or there's some stressful situation. We don't want to only breathe in our belly and our rib cage laterally and only have parasympathetic activity, although that's needed more today than ever before because we're so stressed out. We ultimately want to have full rib cage elasticity and full functional breathing. However, because the rib cage has gotten so tight, we have a lot of work to do to free the rib cage up from the diaphragm with the tools we talked about, and also do some lateral excursion breathing. Another exercise that I like to do with lateral breathing is to take yourself into a lateral side position like this, put your hand over here in the lower rib cage, and then take a lateral breath through your nose and push into that hand. You can really feel your hand moving. You can sometimes feel your rib cage kind of popping and your spine kind of releasing. It's an amazing technique. And then when you breathe out, narrowing, abdominal contraction, squeeze the air out, then come back over, and then put your hand here, and then take the lateral breath, push it out, and then come back all the way out. Breathe out through your nose. Rib cage becomes narrow. Abdominals start to contract. And then do that 10 times to that side and 10 times to this side. Get into that position. Put your hand here. Breathe into that hand laterally. Push out that rib cage. This is an amazing technique. And then come back, down, breathe out. Rib cage goes narrow. Abdominal muscles contract. Squeeze the air out. And then get into that position first, and then breathe into it. And feel that lateral expansion with, in this case, full, complete exhales bending the other way. Please check out the article associated with this video where you go into more of the details, and there's also science there. And you can also check out all of our information at lifespa.com. And while you're there, if you're watching this video on my website, please subscribe to our channel. Check out our Ayurvedic store on the way out for all of our organic Ayurvedic products. And if you're watching this on a social platform, please like and follow us. And we'll see you all next week for more information connecting ancient Ayurvedic wisdom with modern science. Thanks for listening. I'm Dr. John Douillard.
Do you like this video? Don't forget to subscribe and share.
This recording is brought to you by LifeSpa, where ancient Ayurvedic wisdom meets modern science. Get access to free health video newsletters by Dr. John at lifespa.com. These statements have not been evaluated by the FDA. These products are not intended to diagnose, treat, cure, or prevent any disease.